Excuse me, before the next question, can I just make an announcement? I've been informed there are several cars on Archibald Avenue that are double parked. So the police have asked if your car is there, if you could move it as quickly as possible. Thank you.
We'll do this gentleman and then the lady in the purple who wanted her question.
Senators Reid and Whitehouse, thanks for coming out tonight. Thanks for the spaghetti. Senators Reid and Whitehouse, both of you are undoubtedly aware that Medicaid, the Children's Health Insurance Program, and the Federal Employees Health Benefits Plan, amongst other federally funded health programs, all contain explicit exclusions of coverage for elective abortion. These exclusions have been written into the law or attached thereto by Congress. You are also undoubtedly aware that these exclusions are attached by Congress because without them, the courts and federal bureaucrats excuse me, have historically concluded that without these explicit exclusions, abortion coverage is mandatory. My question then is, first, why both of you voted on July 13th, you, Senator Whitehouse in person, you, Senator Reid by proxy, as members of the Senate Health Committee, against the amendments of Senators Enzi and Hatch that would have maintained, excuse me, the current status quo regarding federal funding for abortion. And second, why you have sent letters to your constituents, perhaps inaccurately claiming that the Affordable Choices Healthcare Act doesn't change the current status quo when indeed it does seem not to do so. Thank you.
I guess it's a very good question, and the way I see it is that it does not change the status quo. The laws that prevent the federal government from directly providing funds for abortion are untouched by this, and I think that this is obviously a very live area of debate, but by not changing the status quo and allowing things to remain exactly as they are, leaving the laws on the books as they are, I think that we maintain what I would consider to be the balance that presently exists on that issue without throwing it one way or the other. I found that the amendments that were offered to this were an effort to change that balance and not maintain the status quo, and I'm trying to fix the healthcare system here, not trying to refight the battle over women's choice.
My response to the amendments that Senator Enzi and Hatch proposed, is to understand the amendments, would in fact prohibit any abortion under with a federal subsidy, where at present the federal law allows exceptions for the case of incest.
Exceptions were contained in the amendments.
No. But I think that to Sheldon's point, I think we assume, and not only assume, it will be, in a sense, the law. There is no mandatory requirement in the legislation that we provided for any type of reproductive service at all. But private health insurers provide these. But again, the essence that we're trying to achieve is giving people the choice in the network of picking plans that they think are appropriate.
But again, changes the current status quo.
I don't see it as changing the current status quo. The laws that are in place are untouched by this.
Let me suggest that I think I was referring to one Senator Colbert.
Yeah, I'm referring to the Hatch and the exception.
Yeah, but the Colbert amendment, I think, was one that went much further than Hatch.
And ma'am, you had...
Yes. All right.
You enthusiastically had a question. So
Yes.
go for it.
3 times I made an appointment with you, and you canceled it. Okay.
What's the question?
Thank you. I'll hold it. I like to be in control. 3 times I met with you, Senator Reid, and you never showed up. My question is, thanks to Brown people, I have a graduate that went to Brown Medical School, and also my husband has been a doctor for 40 years. Okay, he didn't get paid. I sent you an email, Senator, and your staff answered it, not you. Okay? They did nothing. So I had to plug the system and go all the way, because you know, Arkansas lost their bid and it went to Mass. I had to plug away till I got to Bob Harrington, the director of Medicare, to get reimbursed after they didn't pay my husband for 3 months. And back to you, Senator Reid. My husband didn't get paid for 3 months by Medicare. And Blue Cross only pays $42. And that's a nursing home that he sees faithfully a patient. And for 30 days, they call him day and night for $40. Okay, Blue Cross pays $35 a month for a office, hospital, nursing home. And for 30 days, my husband is responsible day and night for that price.
And so your question is?
My question is, on the news, Barack has the audacity to say to doctors and future doctors, oh, we look at the fee schedule, and if they make more money, they'll yank out tonsils. There's no way, under the Hippocratic oath of any doctor, and you students, that they would ever yank out a kid's tonsils. How stupid of Barack to make that claim. And you, 2 senators, didn't come on the airways and back the doctors. And furthermore, you lawyers make tremendous amounts by suing doctors for no need. And in Europe, they only pay $2,500 for their insurance. And we pay $7,500 per person. And do you know why? Because of the lawyers and their lawsuits. Now I'm asking you, you trim the budget on the 5,500 lawyers because you're losing doctors. You know how much it is for a OB man? $100,000 in malpractice. Now you start capping. Now this is awful. You say the average pay for a doctor here is $150,000. They have 3 employees. They pay them $30,000. Take $90,000, you come up with $60,000. You pay $24,000 in rent money. Doctors come home with $40,000. Okay, Senator Reid, how much do you make in your pocket?
I think we understand.
And why did you give all those money to buy all those helicopters or fly all over countries?
Okay, ma'am, can you, thank you. Thank you.
And furthermore, my husband does 25% charity a year.
Let someone else score!
We will.
I appreciate that, thank you.
Want to give people a chance? I got so much.
Question from the other room?
Gotta go to the other room.